virus and go home again. So, of course, analyzing the death rate, but also showcasing that coming into our health system, the kind of work we're doing in the system, also enabling you to get well again and go home. Perhaps the last percentage I want to say is that we also test not only when you enter the system with COVID-19, we also do post-mortem tests, and we are showing now 11% now of our positives are actually post-mortem tests that we're doing, testing beforehand and even after death, so that we're getting the most accurate data that we can in this process. I think that's enough to kind of get the show on the road today. I really want to once again say thank you very much to those health professionals that are enabling us to do what we do, to put out the data on a daily basis, updated on our website, and the hours and hours of work that's going into this. Thank you very much.
Up next, we have the HOD for the Department of Health in the Western Cape, Dr. Keith Kuti, who is going to talk a little bit about the preparedness of the health systems in the province.
Thank you very much, Premier. Gives me great pleasure to be here to just update everybody on the preparedness of the healthcare system. I think I want to start where the Premier left off. One of the most important things is to understand what happens with the deaths, and from that we've identified how we should focus our energy and our efforts on people that's most vulnerable. And therefore, one of the refinements we want to do in the community screening and testing is to have a special focus on people with comorbidities, a special focus on the elderly. So part of the health system preparedness is also to be refined in the way we go out and make sure that we find the most vulnerable and make sure that we protect them against the transmission of COVID. The second big point is, the Premier made, is at the peak, and what's happening now is 90% of people are not going to need hospitalization. So it's really preparing the system of how to deal with the people for which we make a diagnosis and they're well enough to be at home. So that part of the preparedness, a very important piece of work, is that we're scaling up more places where we will be able to do bigger amounts of testing, but we also don't want to do it in a way that exposes people. So one of the key innovations in that space is to identify the places and to also say that we prepare those places where we can do social distancing and we can make sure that we can screen and test. So I'm going to read out the places where we are preparing for these big, let's call it testing and triage centers. They are already in existence at Tygerberg Hospital, at Victoria Hospital, at Kylie Hospital, at Karl Bremer Hospital, at Mitchells Plain Hospital, at Paarl Hospital, at New Somerset Hospital, at George Hospital, Westphalia Hospital in Atlantis, East River Hospital, the Heideveld EC, and in Kraaifontein CHC. In the following places we're busy preparing for those: at the Red Cross Children's Hospital, at False Bay, at Helderberg, at Worcester, in Grootskeer, Mowbray Maternity, and the latest addition is Ceres Hospital, on the back of what has happened in Witzenberg. So these are the places we're preparing where we will be able to do testing and screening. An additional innovation is the isolation booths that we've also got in acceptance. We've got 5 of these. And this is not only at these places, but also in addition to this, there's a further 106 primary care facilities where we will also be doing testing. But the isolation booth, it's quite an innovative booth in that a healthcare provider can take the samples from a patient or a person under investigation without coming to direct contact with the person. So it's quite a useful innovation that the person can put on the gloves, get the sample, and there's a separation between the doctor or the clinician taking the specimen and the person under investigation. So those are very important ones, and that is preparing before somebody gets admitted. The biggest additional thing that we are preparing as a healthcare system, and we've seen this, you might have seen in the media, is working with our health workers, because we need to prepare our health workers for what's coming. And one of the big things is to accept the anxieties, is to be empathetic, and to reach out to our health workers. You would have seen the EMS workers in Khayelitsha about feeling unsafe. You would have seen, and we're aware, at Tygerberg Hospital, staff is feeling unsafe. At Karl Bremer Hospital, people are feeling unsafe. At primary care facilities in Khayelitsha, 2 or 3 of them, we have people where we have infections amongst healthcare workers. And the big thing is, do we have the PPE to be able, but it's not just the PPE. It's really going out of our way. We spent the last 3 hours this morning as well talking to our organized labor colleagues. It's really meeting our staff where their fears are. We're going to be doing in the next 2 weeks places of reaching out to our staff and talking to them, talking through the fears, work with them, meet them halfway so that they feel listened to, they feel heard, and they feel supported, because they're going to be the most important part of what's coming at our way. After that comes the issue, what will we do with the increased number of cases, the ones that has to be admitted? For that, the Premier released last week that we have the Cape Town Convention Centre, and we're preparing for 850 beds of intermediate care in that facility. As of this Friday, we will be going on site to actually start with the renovations, and of next week, we will be seeing the unfolding of the preparation of that space. It will probably be the single biggest place where we will be hospitalizing people with COVID and looking after them in a concentrated way. In addition to that, we have 3 other additional places we're working on. We're busy getting the agreements in place, and we will be announcing that over the next 2 or 3 weeks to work up to a total of 1,400 beds in 3 additional places in the metro and an additional place in the Cape Winelands. The last thing I would like to say, one of the most innovative things that came out of the review that Minister Mbombo chaired with all our clinical colleagues, is to look at innovative ways of managing COVID. There is so many different ways and learning across the world of how to manage COVID. 2 specific ones the clinicians were very excited sharing with us. One is something called proning. Proning is you manage the patient on their stomach. So instead of lying on your back like you normally would lie in a hospital bed, you lie on your stomach and you get oxygen administered from there. The early signs of that seems that that is a very good practice, and it improves the recovery for patients. So that's our team in Grootske working very hard on that, and we're following very closely what happens with proning. The other one, which we're very excited about, is the use of high flow oxygen. So instead of putting the person on a ventilator, is to use high flow oxygen in a high care setting. And also there's some very good promising results coming out of those practices. So I would like to just conclude on that. The healthcare system of this province has always been in a good state. What we've been able to do with COVID is to raise our readiness to do this and be prepared for what's coming at us. We've also had very good cooperation with our private sector colleagues, and we're very close to having agreements that we will do this as a collective towards the peak of COVID. Thank you.
Thank you, Dr. Keith. If we can get the Health MEC, Dr. Nama French and Mbombo.
%80 of cases, positive cases, they are being managed at the primary healthcare level, which is at home. It's only about 10% or so that are being managed, that are hospitalized. So therefore, it means that the COVID stays in our communities. And the first thing first is about prevention and promotion, and also taking responsibility as communities. Because we cannot only rely on health only, when only the people only come to our health facilities only at a later stage for hospitalization. So what do we mean by the prevention? It's a responsibility of everyone, the whole of government, the all other departments, the whole of society. First of all, it's about, as Dr. Keith and also the Premier has indicated, the protective clothing. Department of Health provided the guidelines on what kind of the protective clothing you can be able to make use of in the workplace and also elsewhere. Starting with when you can wear the goggles, when you can wear the face shield, when you can wear your mask, and also when you can wear your gloves, and also when you can protect the body. But one protective clothing that is compulsory to everyone, it is the cloth mask. So it's irrespective whether you are in the health space, whether you are in the shops, whether you are anywhere, cloth mask is compulsory to everyone. And also secondly, it's about the issue of protecting the vulnerable groups in the community. As I indicated earlier, 80% of the COVID cases are being managed outside in the communities. Currently, we know that it is social grants, and there are many people, the older persons who are vulnerable, who are making use of these outlets. True, that is being managed by the National Department of Social Development. We are urging for the people to conduct social distancing, to help the elderly so that they don't have to be squashing there. So meaning the second part of protecting yourself is the social distancing. Wherever you are, in the shops, in the workplace, in what I've just mentioned now, it's important you keep 1.52 meters to 2 meters distance to prevent the spread of infection. The other part is simple, is the hand hygiene. Washing your hands every 20 minutes wherever you are, taking about the 20 seconds, and also using the sanitizers if you cannot able to wash your hands. And remember, when you put on your mask, you wash your hands first before, so that you cannot be able to contaminate your mask. Remember, again, you'll be touching everywhere. Surface hygiene is also important because wherever you touch, there might be also some of the COVID or other viruses or any other bacteria or other germs that are there. It's simple because people ask, where am I going to get the sanitizer from? Just iqephe le bleach kunye neliter yamanzi. Or 5 mils of a teaspoon of a bleach into a 250 mils, which is a cup, where you can use and clean the whole of your surface. Again, it is important when you are ill, stay at home. Don't go and mix with other people. At the shops, make it a point, you sanitize your trolley, you keep a distance, and also make it a point that you don't touch everything that is in the shop. So we urge the communities that whilst health can do as much, whilst government can do as much, but at the end, the behavior is the one that will make us to determine whether we can be able to flatten the curve by making sure that we behave accordingly. Thank you.
Up next is Solly Fourie, who is the HOD for the Department of Economic Development and Tourism, and he's going to talk a little bit about workplace prevention and safety.
So from the economic cluster's point of view, we are also very concerned about the spread of the COVID disease and the infection. We're also equally concerned about the shape of the curve below the line, as we call it, the one that's going southwards. So we're trying to ensure that through responsible opening up of the economy, we can also have more people at work, but provided that those people are also applying the hygiene standards and taking care of the health guidelines that we have put out for the workplace management of the disease. We published this week, together with the Department of Health, we published the Western Cape's guidelines on how to prevent and manage the COVID infections in the workplace. We've also sent out a frequently asked questions document and posted that on our Corona website. And the guidelines runs through the maneuvers and the measures that is expected for businesses which are currently opening, and for those who may open in the immediate future, to prepare themselves to make sure that their business is fit to be able to meet the demands of a COVID management and a guideline management. Amongst what we're trying to do there is to demonstrate to business how they can perform an assessment of the worksite, how they can, given the potential risk of employees that are affected, limit the infection spread in the workplace and thereby protecting their employees, advice on the provision of personal protection equipment and personal protection methodologies and methods, and also guidelines to help the business should an employee be found to be positive or have symptoms of infection, and how to manage that employee in the workplace. We really seek to do three things and three objectives, and that is to reduce community infections in the workplace, to enable businesses to stay open through this alert level 4, and in order to do that, also to reduce the workplace infections, and then to illustrate how businesses can manage the COVID-19 reasonably and responsibly, and enabling businesses to remain open. I think it's very important that we are looking at increasing economic activity in a responsible way, and that we are looking at businesses to be responsible and to help those businesses indeed to be responsible in the management of infections and the management of the workplace, so that they can do that effectively and continue to trade. We are also very involved as the economic cluster to look and to get personal protection equipment procurement locally to ensure that we have enough supply, and to see how our current manufacturers of PPEs can expand. Obviously, for many of our current manufacturing sector, a lot of their work had to stop, but a lot of them have moved away from their traditional way of working or the traditional outputs, and they've now started manufacturing cloth masks. Particularly this week, I attended a visit to Monatic, House of Monatic in Epping, and there they have stopped their suit manufacture and have gone to the manufacture of cloth masks. I think one of the other things that we are looking at is making sure that businesses are supported in this very, very difficult times. As an economic cluster, we've established the supportbusiness.co.za website, and that is an area where many, many businesses have gone for help and support. 49,000 visitors since the lockdown have visited that website. We've also at that website done a funding finder or a fund finder tool, and 5,798 businesses have accessed that fund finder tool to access the government incentives and government support that is given to businesses at this time. We are also very much aware of the fact that there are informal businesses and spaza shops that needs to be trading at this time, and we've assisted 3,300 businesses in the informal sector to get informal trader permits from the various municipalities. We are also pushing quite hard with the unemployment fund to ensure that the monies to the unemployment fund is being disbursed, and to date 7.04 billion rand have been disbursed to 1.2 million workers throughout the country. And even though we don't have accurate figures for the Western Cape yet, the estimate is that 15% of that funds have been sent to the Western Cape. So the economic cluster is one, supporting the Health Department of Health to ensure responsible opening up of the economy, and secondly, we also wanting to make sure that we are supporting businesses in this very, very difficult time to trade and perform effectively and responsibly, adhering to the guidelines that we published. Thank you very much.
Thank you, Sally. We're going to move into questions now. Could we get Dr. Klütti to come and handle the health questions first, and then we'll take it from there.
Thank you.
Dr. Klütti, you mentioned earlier the sterile booths for testing. Which 5 facilities have these booths, and will they be rolled out to all facilities where testing takes place? What is the reason for initiating the project at these facilities specifically?
Yeah, so the facilities that we chose is the high volume community health centers in the metro. So those are the places where we expect more people to come to be tested. So it would be your Mitchells Plain Community Health Center, it would be at Retreat, and the 3 others also part of the metro. The idea is we are evaluating the effectiveness. As I said, it is the doctor can go into the booth, and there's a separation between the doctor and the client. And it's literally putting your gloves in, getting a sample, taking a sample from the person, putting it into the sample kit without any contact between the doctor and the person. So it's a very innovative one. It's being assessed. We will see how effective it is, and depending on the effectiveness and how easy it is to use, we are thinking of rolling it out depending on that.
Is the Western Cape Health Department in support of the TB BCG clinical vaccine trial? And if the results are positive, are there plans to conduct mass vaccinations?
We're very much excited about the innovative research. We just say that the Health Department and TUSC has a long-standing history. Really want to acknowledge them. They're doing really groundbreaking TB research. There's very few groups in the world that does the kind of research they do, and I've got the highest respect for Professor Dijken, Professor Skalf, Professor Anneke Hesseling. Those are all the colleagues that's been for years and years worked with us in this field. So because we've done such a lot of work in TB research in Cape Town, specifically in the Western Cape, it is really good for us. We support it. It's early days, and we don't want to pronounce on the results. We first want to see empiric evidence that there is protective qualities associated with the research. So we're really watching it with keen interest and with great support.
Well, following on from that question is another question around the herbal treatment in Madagascar. What is the Western Cape's view of this, given the national government's recent statements in this regard?
Yeah. We must say that, and Minister Mbombo, myself, were with all our clinical colleagues. I think one of them made such an accurate remark in this regard, and that was Professor Ivan Jaber from Grootskip. He was saying that there's lots of things that people will do and try in terms of management and treatment for COVID. These are done under trial conditions. Until there's sufficient evidence that under trial conditions there is impact, until that has not happened, it will not form part of mainstream management of COVID. So I think it was it made us aware. There's many things that people say potentially could make a difference. Anticoagulants, the use of chloroquine, the use of a range of things, the use of possible herbal methods or whatever. But until they're under trial conditions, there's sufficient evidence. At this point in time, none of those are in the mainstream management of COVID.
Can you please elaborate on the testing delays you referred to earlier this week? How long have the worst delays been? What impact does this have on managing the epidemic? And what has caused the delay? And what progress has the Western Cape government made in resolving them?
The worst delay has been people waiting in certain instances for more than 7 days for a result. Now that is at the height of what we're doing. Really, really disconcerting for the person that went for the test and for the health workers that needs to respond to the person. I just need to explain, there are, for us in the health department, 5 different streams of testing with slightly different implications. The first and the most important stream for us, as you can hear from our inputs, is the stream for what we call somebody that's under investigation, a person under investigation in an acute hospital setting. Now, if you wait too long for that, you can't wait for 3-4 days waiting to hear whether you got COVID, because you need to be managed in the hospital. So that's the most important one for us. The labs have helped us, even with this backlog, to try and prioritize that group of people so that we can get the results early. The second most important one, and that's the one that I will come a little bit back to, is healthcare workers. You can't delay the result for a healthcare worker to understand whether they're positive, because it's got so many knock-on effects in terms of this. The third one after that is the person from the public that feels ill, presents themselves for testing. So if that gets delayed, you can understand the anxiety. The fourth one is us going into communities and doing community screening and testing, and then taking tests. And if that delays, can you imagine how that is? And then there's a last one, which is the one we've been doing for the last 2 or 3 weeks. It is following workplace clusters. It's clusters of cases that you go. Now, part of this was when we did the analysis with the National Health Laboratory System, is the scale up of testing in the Western Cape over the last 2 weeks was of such a steep nature, it exceeded the capacity of the National Health Laboratory System to keep up with the increase in demand. So that is the main reason why there's a delay in the tests. We have had engagements with them. We've got some agreements, there is some movement, there's some improvement. The waiting time is down to 2 days. They have a 2 days lag in responding to samples. We have made a decision that as of today and as of tomorrow, we will be using private sector capacity as well, in addition to the National Health Laboratory System. Plus, the Minister and the Premier has written respectively to the National Minister and to the President. So it is getting attention at the highest level in the country. So we are looking at bringing the capacity that's required online over the next 2 to 3 weeks. And we have multiple multiple solutions on the table, including process re-engineering, processing the lab, processing the results, all of those in terms of that.
I just wanted to check with you. We've heard that most of the infections are from areas where people are actually gathering legally, essential workers, people who are going to work, people who are on the farms, people in the factories, people in the workplaces. How are we going to remedy that?
That's a very good question, because what our experience has been is that the uptake of cases in the Western Cape happened in lockdown. And that's what we've been saying and tracing for the last 3 to 4 weeks. And that's where the steep incline of testing happened in this province. The big thing there has been that we recognize that people need to be in the workplaces, in essential workplaces. But it's the big thing of driving the things that Minister Mbombo was mentioned. It seems simple, but it's the uptake at the place of an individual to say, I observe the 5 golden rules and be very strict on social distancing. One of the big concerns we have by adding the cloth mask, that we don't see a phenomenon that people believe by wearing a face cloth they can compromise on social distancing, that they feel that they're protected. That's why we're saying cloth masks must be used responsibly and always with message. So I guess the answer is, like Solly has said, in all these supermarkets, what we've gone back to, because many supermarkets had to be closed for varying periods of time over the last 3 weeks, to clean the surfaces, to make sure that the people that were positive and the people on the shifts were all isolated at home, that you get people that work in the shop with clean surfaces that were not affected. And all of that has now led to the fact that we've got these very specific guidelines for all workplaces. And according to those guidelines we go through, it is really getting the basics right. So there's a window of opportunity for all of us in this province, while the cases increase, to really drive the behavior home of basic distancing and all of those. So there's concerns for us, because what has happened now, in the shops where you go, you will now find somebody at the door of the shop, closed, stops you, there's one entrance, they take temperature, they screen, you must have a cloth mask. You go in the shop, it's distance, all of the people observing this. One of the concerns is everybody outside the shop is not observing social distancing. And that is part of the problems. At health facilities, Minister Mbombo 2 weeks ago was very concerned that people come to health facilities, you go inside the health facility, you get distant. But the people queuing outside to get in were not observing the behavior. So I guess it's really, really going back for us to really drive that hard. And with Solly and his colleagues with workplaces, that's part of the message to the broader public, that we really have an opportunity to turn the spread around by just observing the basics.
Dr. Kitty, what is the reason that the Western Cape's death rate is higher than any other province?
Can I just qualify that answer very simply? Sorry, I was not observing. As the Premier said, when you talk death rate, the rate out of cases, it's 1.8%. It's not higher. That's not the highest in the country. People must look at the number. That's a rate. The number of deaths is higher. That's the number. And the number of deaths is higher because we have more, from our point of view, established local transmission. So because we have more cases, we have more deaths. That's the reason.
Two separate questions, but with very similar sort of ideas. Has the Western Cape published its forecasts on the virus and when the peak would be? And has this been peer reviewed? And then following on from that, is the Western Cape doing its own COVID-19 modelling? And if it is, will these model outputs be published together with details of model assumptions and model design?
Just to clarify, the Premier, myself, Minister Mbombo, Professor Andrew Bull, did a press release 2 weeks ago. We spoke about scenarios, and at the peak, according to those scenarios, that we will be 1,000 beds short for acute beds and 750 beds short for critical care. That is based on applying scenarios, epidemiological scenarios, to the unfolding modelling work that was happening at that time in South Africa. What we are doing is we are taking our modelling scenario assumptions and we are working with the recognised modelling groups in South Africa. At UCT, there's a MASHA group. They're one of the 3 that is part of the National Consortium on National Modelling. And we're also working with the Actuarial Society of South Africa, which has this week released their modelling assumptions for a model for South Africa. So we would really benchmark our assumptions on forecasting against these modelling. There is an undertaking that in the near future, and the Premier will announce when that is, that we will make those all public.
Question from the SABC.
Good afternoon, Dr. Kluti. My name is Vanessa Puna. And perhaps this question would speak to both the Health Department as well as the economic cluster. You know, we've seen reports that there are staff at, for example, private hospitals, like at Convention, Melamed in particular, that are accusing management of keeping mum around the status of patients. Just this morning, Golden Arrow has reportedly had protests with staff calling for mobile testing and not just screening of staff, also for themselves and the hundreds of commuters they carry. And then, of course, the issue I think you started addressing it around the supermarkets, you know, where the safety of staff as well as consumers are coming under question. Now, when you spoke about preparing the health department, nurses, doctors, medical staff, around the issue of what to expect at the peak, there are the fears that within workplaces themselves, that staff are feeling that not sufficient is being done by management and so on. So, you know, is this a competency where the health department will step in provincially? Who manages this process, especially if it's in the private sector, you know, where these concerns are coming from? Thank you.
Thank you. That's an excellent question. It's probably the one question that should keep all of us awake. That's the one that keeps me awake and the management team and the health department awake. We've spent many hours in the last 4 weeks building a relationship with organised labour in our health department in the Western Cape. I just said that we spent 3 hours with organised labour. And one of the things I've learned from that, which was some of the comments the colleagues made from organised labour this morning just struck such a chord with me. It is the point you're making. A technical answer of saying the evidence suggests this will protect you doesn't answer the fear and anxiety that a person has that has to face uncertainty, that goes to a workplace and is not sure whether they themselves are going to get infected, and the fear of going back to their own families and infecting their families. That must be the most scary prospect for a person. So our answer is a simple one. Turn our focus to try and put ourselves in the shoes of the person that faces that fear. So from our perspective, we would like to go and talk to our staff, to hear them, to give them the space to verbalize this fear. It does not help that you then say, hush, and say there is no infection. This calls for being open, transparent, and saying these are the numbers, we have to talk about it. I can tell you we track on a daily basis, and as of yesterday, there's 191 healthcare workers in this province that is positive. That is over private and public sector facilities. 17 doctors, 70 nurses, 104 other categories of staff. That varies from pharmacists, from porters, from security guards, from everybody potentially in that institution, including administrative staff. That is, and what we found also, laboratory staff. People that works in the laboratories that's supposed to do the test for COVID, also being infected. Now we have to recognize it, own it, and engage the fears that goes with that. We are very much familiar with, as I said to you, in Tygerberg Hospital, because Tygerberg Hospital is the single hospital with the biggest number of healthcare workers in this province. There's 3,000 workers. So when we start having the numbers at Tygerberg Hospital, people are panicking. But there's 3,000 workers, and there's a big number. So there, as I'm speaking to you now, our management team is meeting with the organized labor in Tygerberg Hospital to discuss these fears. And it's not going to be an easy conversation. It's a conversation about understanding the fears. But we're aware of Malamed and Mediclinic and all the others. We're reaching out to the institutions to say, please open that conversation. We cannot have the conversation as a health department for others. We can say, this is what we're doing. We can share. As we speak, actually, that conversation is busy happening as well. Another conversation where, together with the private sector, our managers and private sector managers are both having a conversation about these 191 healthcare workers. That's how seriously we're taking it. We also know that 32 of those 191 has recovered. So there's also stories to be told about healthcare workers that have recovered. And we also know that 10 has been hospitalized, and there's 2 deaths in the Western Cape that has come out of that. So when we sit with our organized labor, we're open about this. And we say, what do we do together? They shared with us this morning, because of the nature of the infection, some of the organized labor shop stewards are starting to become positive. How do they continue working with their staff when the shop steward is positive and have a conversation? They must allay the fear and work. But it was such an amazing experience meeting with these colleagues, because we all said we have a social compact, we're doing this together.
A question regarding changes in HIV and TB testing. Have we noticed any change in the testing numbers? If you're able to give any numbers, is there a concern that viral loads are not being suppressed during this time? And is the province concerned that other health conditions could be crowded out of the healthcare system as case numbers increase and more attention is put into COVID-19?
That is a real concern. I think Minister Mbombo's asked that question, the Premier's asked that question a few times of us. If I explain to you our preparedness of our system, we are not crowding everything out for COVID. Our planning at best says we crowd out 50% of what we've done to this point to make way for COVID. But it still means 50% of what we have as our capacity is to deal with everything else. In that is the big thing. So maternal and child health, deliveries can't stop. Looking after children and giving children immunizations can't stop. Those things we continue. But now we have to think differently. That's why delivering babies at Mowbray is one of the busiest delivery places. Those deliveries have continued. Up to 1,000 deliveries a month. It is not decreased. The problem is people have to come in, deliver, their staff has to come in there Therefore, Mowbray is also at the risk of getting COVID, but we can't stop delivering babies. The same with the Red Cross Hospital. We cannot stop seeing children. We have to continue doing that. Mental health patients, we cannot stop seeing mental health patients, but it brings the risk of COVID. The ones that we're concerned about, because the area that COVID potentially crowds out, is the competing adult medical conditions, which is where hypertension, diabetes, heart disease, and then HIV and TB comes in. So the short answer is, all of those will suffer, and it has suffered under this. The impact of that suffering we need to keep an eye on. I said yesterday to somebody else, it was actually a very good thing, that one of the things that we learned, because we have so much TB in this province and HIV, is that we learned very early, when we didn't have COVID, how to manage those cases out of facilities. So one of the big advantages actually of having a TB and HIV program is when COVID came and we had to manage other people outside the healthcare system, we can draw from our experiences of HIV and TB. Because the majority of HIV and TB is actually being managed away from a health facility. So we'll keep an eye on it, and it's something that we at periodic times during this should constantly be vigilant about. TB and HIV remains TB remains probably the biggest healthcare challenge in this province. That's not going to disappear with COVID. HIV, the controls that we've got and the gains we've made, we cannot afford to slip back on the controls and gains we've had. Thank you.
Dr. Kuti, what does a COVID-19 test provided by the NHLS cost, and how does this compare to the price you would pay in private labs? Have you been able to negotiate a volume discount?
Yeah. So the price is roughly, as I understand from NHLS, let me just explain. The National Department and the National Health Laboratories has been providing the PCR test for public sector, not free of charge for the province, but the cost has been borne by the NHLS. So they haven't charged the province. But still, you pay for the test, but it's being paid from a central perspective at national. Private sector tests, so that test, my understanding, is in the vicinity of 300, 400 rand. That's where it is. If you go to private sector tests, you can get it for 800 to 1,000. So it's about 3 times the price. One of the considerations we had as a management team is we're approaching the private sector today and having that conversation with them that we are going to start using, and we want to understand that we get a reasonable price in terms of that. Thank you.
And then the final question for you for now, Dr. Kuti, because I want to bring Premier up to answer some of the questions as well. Why do you believe that the province has the highest number of local transmissions?
That's the million-dollar question. We would like to say that we have, through our data, have proven and has established that we have established community transmission. From the data comparison with other provinces, it seems to be that our transmission is more established, and in a sense, we're earlier in the uptake of community transmission than other provinces. I don't know enough about the data of other provinces, but we can say that we have established community transmission. The reasons why, but at this point in time, would be speculative, but it is that this is what we have in the Western Cape. Thank you.
Thank you, Premier. There are a few questions around interprovincial travel, which ends at midnight tonight. Is there any indication of how many people have left and entered the province, and what screening protocols were put in place to monitor their health status? The Eastern Cape MEC has said that over 50 people who travelled from this province to theirs have tested positive over the last week. How are the two governments engaging to put better measures in place to curb the spread as travel between both provinces happens weekly due to funerals?
Okay, so first of all, I think that with regard to the numbers of people travelling, we don't really have an answer to that because there was no permitting, etc. But we do have numbers of people going through our roadblocks. So between 4,000 and 6,000 people going through our road blocks on a daily basis on those on those main arterials like the N1 and the N2. That's the only real number that we could base it on. And then with regards to specifically the province to province, Western Cape to Eastern Cape, the Premier in the Eastern Cape and I have had a meeting with our MECs of transport as well as the police commissioners, so that we've had this discussion. It's about funerals, but it's also about essential workers who also have been travelling, and specifically in our province, agri workers. So with regards to the funerals, it's about permits and a protocol of screening and testing. So that's an agreement that we've got between the two provinces. Our protocol has now been put together and is being sent to that province for them to have a look at it. So we agree. Screening happens on our side. And then what happens is there'll be a screening process on their side as well, and then an agreement that transfer could happen of people moving between provinces.
Given the number of infections in our province, and if this persists, is there a possibility of us going back to level 5?
So I want to say that right now, of course, there's always that possibility, but as at now, we are monitoring and managing the system, and I will go out to people to say, please, you've got to make sure you help us when you gather, because it's the gathering, as we first heard, in the shopping spaces, and of course now as the economy opens, there are new front lines opening up. We need to make sure that we're following, as Minister Mbombo said, our masks, our social distancing, our hygiene practices, because it's balancing the health and the economy, and I really would not like to go back. We need to open up our economy, but the whole reason we're trying to slow this down is to get our health system in place. And you heard Dr. Kuti talking about all of the work that's being done in the testing and triage space, and now all the work that's being done in the extra bed space. And we need a few more weeks. We've got to get all of that in place. Once it's in place, then obviously it will enable even further opening up, because then we've got our best possible health response ready to deal with that curve. And also, you must understand that our numbers are going to continue to increase because we've got community transmission happening now. And when community transmission happens, then the rate that we're having it at the moment, we double our numbers every 8 days.
Can the Western Cape government override the national government on the regulations specifically around cigarettes and alcohol? Is liquor sales not controlled at a provincial level?
At the moment, my answer straight away is no, we can't. It's a disaster declaration, and we have to, as a country, abide by the regulations that come out through the disaster declaration. We make motivations to be able to try and influence and assist where we would see change that would be needed, and we make those interventions all the time. But under the disaster declaration, it is a national competency and national regulation.
We have observed that taxis and buses are not obeying the capacity regulations. What is being done to address this?
Okay, what we have created now is an ability for you to SMS a number and then report that specific bus or taxi that is not adhering to the rules. And you've got to SMS star 134 star 234 hash. I'll say it again. Star 134 star 234 hash, and you can report that specific taxi or bus that is not adhering to the rules. I also want to say to the commuters, and I understand the pressure that you're under to try and get from A to B, especially if you're an essential worker, but you also need to say, if that vehicle is full, please don't get in it. Everyone's got a responsibility here. There's a mechanism to report it, but also we need to be following our own responsibility, or carrying through our own responsibility, and making sure that if we see the capacity is overloaded in that specific vehicle, stand back and say you'll rather wait for the next one.
Thank you, Premier. We're going to bring MEC Mbombo back. Minister Mbombo, you've been visiting farming communities in the past few weeks. Have you seen any change in terms of behavior and cooperation?
I think we need to differentiate between the specific farming community plus also the agri-processing, which is mostly the industry and where mostly is the packing. In the farming space, you'll find that the social distancing is easier to apply, and also because they are in the close community and some of them they are living there, they're staying there, you'll find that it becomes easier. They are not as affected as the rest of the people who are outside the farm, which is in the industry in terms of the agri-processing and the packing. Where I visited, specifically in the packing in some of the farms, you'll find that they've done quite a lot when it comes to the social distancing and the correct clothing and the hand hygiene and the surface hygiene. So we need to acknowledge the work that has been done. I haven't visited all of them, but I do get some of the concerns. People will be saying that in one packing area industry, there are about 70 people, and you find that it's not conducive. So normally I raise the issue even with the Department of Labor and also with our cluster on the economy to make a point that the measures are put in place. Taking note that employers got a responsibility to ensure the occupational health and safety measures as according to the legislation has to be put in place. Health can do as much in terms of assisting with the guidelines together with the economic cluster on different industries. For example, if you are a petrol attendant, what kind of measures that you could put in place? If you are a shop assistant, what kind of measures you can put in place? If you are in a factory setting, what kind of measures? Do you need an open barrel system or what?
Minister, are health inspectors investigating the unknown brands of cigarettes that are being sold illegally and the associated health risks? And are there any associated health risks?
I think that information is everywhere, whether you Google it or also in the various articles. I don't think now that there is COVID, you could go back in terms of challenging the evidence that is there. Of course, smoking and also related to the lung cancer has always been there. So without even putting COVID in terms of in the equation.
Thank you. If we can get Sally Faree to come and answer on the economy. Thank you, Minister. Has there been any engagement regarding COVID-19 and government's interventions with the Cape Business Chamber and in other municipalities? And what has the outcome of these engagements been?
Yeah, so we've been engaging quite widely across all of the economic sectors and all of the business institutions and associations. During last week, we had a meeting between myself, Minister Mania, and the executive of the Cape Business Chamber. But we've also been consulting the AHI in the Western Cape, which is also a very large business chamber. And we've been engaging a number of different industry bodies. So we have regular engagement with the retail sector. We've got regular engagements with the shopping mall owners and with the property development owners. And all of those are intended to ensure that the guidelines are implemented within their specific industries and within their certain sectors, their specific sectors.
Thank you very much. Dr. Kuti, there are a couple of last health questions, so if we can have you back to respond to those, and then we'll have Premier wrap up quickly. I just need to find them. On a point of clarity, are clinical trials being conducted at Tygerberg Hospital to find a vaccine, and when are results expected?
I must confirm about vaccine, but I know there are clinical trials around different treatment modalities. I'm not aware of a clinical trial for vaccine, but there could be, but I must still confirm that.
What special precautions are in place regarding patients in hospital being infected, referring specifically to Swellendam, where the emergency section was recently closed?
The special precautions we have in place is that in every health facility, we have what we call streaming. So if you come in to the health facility, you go into an area where before you come into the hospital, you are decided whether you're potentially COVID or not COVID. So there's a streaming activity happening. And when you then go into the potential COVID area, that's where you're being managed, and we have maximum PPE for that area as opposed to the non-COVID area. The specific situation in Swellendam was because of a case being positive, and we had to make sure that all the things are cleaned in the surface in accordance with the guidelines for workplaces.
Thank you very much. We're going to bring Premier on to just wrap up. Thank you to everyone who participated today.
Thank you very much. Thank you very much to Minister Mbombo, to HOD Fourie, and of course to Dr. Keith Klutti. It is always nice to have a professional team around you that is able to not only just answer the questions in a press briefing, but that are actually holding this all together in steering the ship. I want to also just use this opportunity before I close just to correct something that I was made aware of, that I made a mistake earlier on. And I spoke about the 90% and the 10%. The 90% infections, and I said, are asymptomatic. I must correct that. They are asymptomatic and symptomatic. But it's the 90% that are able to recover, as Minister Mbombo said, at home. It's only the 10% that actually come to our hospital facilities, and that is what we really are working like crazy at the moment, day and night, to make sure that we have that covered. That's the 1,500 beds or 1,400 beds that Dr. Klutti spoke about. I also want to say that, and again reiterate, that the stage that we are in the Western Cape is community transmissions. This is where this virus is being caught through those interactions at your local store, when you're gathering to get your grant, anywhere where people gather. That's where those transmissions are happening. And so please, my message is we must continue while we are still getting those extra beds in place, while we are still finishing with our health response. I really implore everybody, make sure you follow the mask, the social distancing, the hygiene practices, because we've got to keep the growth of this virus in a controlled manner. I'm saying it is doubling every 8 days, but we can't afford for it to double every 6 days. And so everyone needs to play their part, responsibility as citizens, and of course we as government are working day and night to make sure that we've got the best response possible for you as citizens as we move to the peak, which is going to be with us in a very short while. In a good few weeks, we're going to be at that peak, and we've all got to be playing our part so that we manage that as best as we can. Thank you very much for tuning in, and thank you very much to all of you for giving us your time today. Thank you.
Everyone waits for the
Mrs. King.
Well done.
Yeah, sure. I must say I don't like
Yeah, I went for 6 kilometers run, so it is impossible. Like, it's actually suffocation.
I'm not back. I'll be my back.
Still trying to clean your floors with that dirty old mop? You need the Floorwash 2-in-1.